So Smart Lipo is a type of liposuction procedure that utilizes a laser. And what's unique about that is by utilizing the laser, it allows us to do several things that are very different from traditional liposuction. The first thing we can do is we do what's called tumescent anesthesia, where we actually take a fluid with a medication called lidocaine and we pump it into the area that we're going to be doing the liposuction on. It numbs the entire area, just like when you have the little shot that numbs your tooth when you go to the dentist's office. That allows us to do the procedure safely and comfortably while our patients are awake. So there's no IVs, there's no anesthesia to recover from, and that makes it a much easier procedure for the body to handle. The other thing we can do is that the laser actually melts the fat. So when we go in, we numb the area, then we introduce the laser. It's in a very tiny little cannula, all right, and we go through and we treat that area with the laser. And you can actually hear the laser working, which is kind of cool. And we put the laser in, we treat the area, and what the laser does is it actually melts the fat cells so that the fat cells are no longer alive. So the fat's just released into the body. And what's cool about that is with traditional lipo, you're actually kind of cutting the fat out, sort of like you can imagine using a cheese grater. So it's a little bit more of a, the procedure itself takes a little bit more effort and it can be a little bit more uncomfortable for the patient. But using the laser melts the fat so that we're able to retrieve it much easier. The other cool thing about the use of the laser is that the laser actually heats the skin. And so by heating the skin, we cause a tissue reaction that causes the skin to make collagen over the next 3 to 6 months. And so you'll get a small skin tightening effect of the skin over the area that we're treating with Smart Lipo. And then lastly, the cool thing about using the laser is that you have what's called tissue coagulation. So when you go in and you can imagine you're using the laser in this area of fat, if you're cutting the fat out, you're obviously destroying some of the vasculature. And so you're gonna have bleeding, bruising, swelling, and all those other kinds of things. But the laser actually coagulates that microvascular, the microvasculature, so that when you use that, there's much less bleeding, much less bruising, much less downtime. So traditional lipo, you're gonna be in a garment 6-8 weeks minimum. With Smart Lipo, 3 to 4 weeks is usually sufficient for being in a surgical garment, and that's much nicer for the recovery. We treat lots of areas. The most popular, obviously, is probably the abdomen, okay, for males and females. The flanks area, and that includes the flanks in front and in the back, okay? Also, really popular areas is underneath the chin. That little fat pad underneath the chin is very bothersome for a lot of people, and it can be hereditary. The other places we treat are lower bra fat for women, upper bra fat for women. We treat around the knees, inner and outer thighs for women, and for a subset of men who have gynecomastia, which is male breast tissue or fat accumulation around the chest, it can be very successful if you choose your patients carefully. The risk for Smart Lipo are extremely low. The reason for that is because of the tumescent anesthesia, you don't have the risk of a general or IV sedation anesthesia, all right? It is a minimally invasive procedure. The actual incisions that we make are extremely small. They heal up very quickly. Because this is a sterile procedure, very low risk of infection. Because we use the laser and you get coagulation of the microvasculature, a lot less risk of bleeding and bruising after the procedure. So it's very safe, and there have been probably hundreds of thousands of Smart Lipo procedures performed since the technology was introduced in late 2007. And we've never had a complication here, and we're very proud of that. So what we do for most of our patients, they come in We will get them dressed in a gown, and they bring comfortable socks because your feet can get cold. Some of our patients choose to take a medication that can make them a little bit less anxious if they're having some anxiety about the procedure, and that's generally given about an hour ahead of time. Then we take you into the photography room. We take pictures of the areas that we're going to be working on, and we also will mark the areas. Yes. As with any procedure, there's going to be recovery. The nice thing about Smart Lipo is because it is a minimally invasive procedure, there's less tissue disruption and other things like that, then the recovery itself is usually not a big deal. If you have Smart Lipo on a Friday, you'll be back at work on Monday. Now you will be in a garment, but the garments that we use, you can wear underneath regular street clothes, no problems at all. Okay. Obviously you'll be a little sore and tender. We have people who will take some Tylenol with codeine for a couple of days afterwards, not usually much more than that. Some people don't take any pain medication at all. Obviously we wouldn't want you to have Smart Lipo today and go work out tomorrow. You probably wouldn't feel like it, although we have a lot of people who will go take a walk or walk on the treadmill or do something like that even the day afterwards. As far as recovery, most people are back to their normal activities within 1 to 2 weeks. Of course, it's all patient dependent. We all heal differently. We all experience pain differently. So, you know, it's more of a patient dependent process, but you're in the garment for at least 3 weeks. Most people are back to all of their normal activity within 3 to 4 weeks. And that's opposed to a regular liposuction procedure where you may be in a garment for 6 to 8 weeks and you may be sore, swollen, and tender for significantly longer. Drainage is very normal with Smart Lipo. Because we use a fluid that has lidocaine in it to get you numb, we might put 1 liter to 1.5 liters of fluid in your abdomen when we do the procedure. Well, the fluid has to come out somehow. And that's why we actually don't usually put stitches in our incisions, because we want that fluid to drain out. Otherwise, your body has to deal with it, which it can, but it takes it a little longer to drain the fluid lymphatically. So if we leave the incisions open and just put some absorbent bandages on the incisions, it allows them to drain. And that process is usually within the first 24 hours. There's usually not drainage after the first 24 hours because your incisions have already healed. So it's just that first 24-hour period that can be a little messy. Most people do really well with it, and it's not much of a problem. Great question. Most people can see a difference within a month's time. That being said, we all heal differently. There's inflammation in the area, but really what we say is your final results you will see at 4 to 6 months, but you should see something that's different quite quickly. The pricing of Smart Lipo varies based on the area that we're treating and sometimes the size of the area that we're treating. You'll notice I didn't say the size of the person that we're treating. You can be a small person and have a very large area, and a lot of times that's based on how we're built, which of course we know sometimes that's determined genetically. Smart Lipo is great for those areas that we call our problem areas, that no matter what size you are, it's that one spot or that 2 spot, or sometimes even those 3 spots that you just can't change. And so that's what Smart Lipo is really great for. The cost, again, depends on the size of the area and the area that we're doing. If I had to give you an estimate, you know, you could spend anywhere from $2,000 to $10,000 on average for a Smart Lipo case. The thing you have to understand is this technology is available to all physicians, okay? And really what it comes down to is, you know, are you comfortable with your physician? Are you comfortable with your location? And do you feel like that the person who's doing your procedure has the experience in the eye and the passion to make your procedure the best it can be for you. And you can't really put a price tag on that. Of course. What's interesting that we've noticed in the many years that liposuction procedures have been, something that's been very commonplace, is that oftentimes the area that you treat seems to be protected initially from a weight gain. And what I mean by protected is that those fat cells have been removed. Now, we all know that we all have stem cells in our body that can become anything. Our fat's no different. We can create new fat cells, all right? But what we've noticed is that if you've had an area that has been treated with liposuction or Smart Lipo, you'll tend to gain weight in other areas first. So you have to be careful. If you've had your abdomen and your flanks done with Smart Lipo, if you gain 10 or 15 pounds, you might gain it in your arms or on your hips. So really, this process is about a commitment from the patient as well. We want you at a body weight that is somewhere that is in a comfortable range for you to maintain. And then you have to put in the commitment because you've put in the investment of your time and your money to maintaining your results. So, Smart Lipo is not a weight loss procedure. It is a sculpting procedure. And so if you have an area where you have a lot of deformity, if there's a lot of excess and loose skin, if you've got a lot of cellulite, or if simply you've decided that you are larger than you're comfortable with being, it's probably not the best procedure for you at this time. The person that's really great for Smart Lipo is somebody who is at a steady weight that they've maintained for a while and that they're committed to maintaining, who has an area that we call a problem area. It's something that whether they've weighed 10 pounds more or 15 pounds less, always seems to be something that draws their eye and draws their attention, that they wish looked better, that there seems to be a fat deposit that just doesn't go away. And so those people are the people that we really like to see because, again, it's a sculpting procedure. If you have a lot of loose skin, like you've had multiple pregnancies or other things like that, stretch marks, we can still do Smart Lipo if there's a significant amount of fat below the skin. You just have to understand that you don't go from having stretch marks and having a loose skin fold to having Smart Lipo and having a tight washboard abdomen. We set the expectations when you come for the consultation as to what you can expect from your results. And I'll be the first to tell you that if what you're expecting is not what I can give you, I will refer you elsewhere or will reset the expectations to a point that you feel comfortable. Well, so there are two different procedures, obviously. CoolSculpting is what is classified as a non-invasive procedure. In other words, we aren't piercing the skin or going into the tissue at all, okay? And so with a CoolSculpting procedure, with any procedure that is classified as non-invasive and has been FDA cleared for fat removal, the studies have shown that the best result that you can expect from either one or multiple treatments of these types of procedures, CoolSculpting, sculpture, whatever the modality is that you can expect about a 20 to 24% improvement in that area. Now, there is one small issue with CoolSculpting that we've seen a few times here, and that's called PAH, and that's paradoxical adipose hyperplasia. There's a small amount of people who get CoolSculpting who later on, their body responds to that treatment by actually making more fat in the area that was treated. And we've seen a few of those patients here and we've done lipo on them with good success. So I would say that the minimum improvement we can expect in a good candidate for Smart Lipo is over 50% improvement. And again, when we're talking about percentages, this is subjective, right? So a minimum improvement with one treatment is over 50%. Smart Lipo, usually you're a one and done type of procedure. CoolSculpting or sculpture, Commonly, it's multiple treatments. So you have to weigh non-invasive 20 to 24% at best, minimally invasive, one treatment, 50% or greater improvement expected with one treatment. So it just comes down to, you know, the perception, I think, is that people love a procedure with no downtime. But if you look at the expense and the time you spend having multiple treatments from one of these non-invasive modalities, you could have done Smart Lipo and probably gotten a better result, in my opinion.